Hello, my name is Toy Johnson, and today I will be presenting my capstone project addressing workplace burnout. The purpose of this project is to examine the causes of burnout among healthcare professionals and propose evidence based strategies to reduce its impact. March 2025 found that burnout continues to increase among healthcare workers. And TEO 2025 reported that burnout negatively affects employee well being, workforce stability, organizational performance, and patient care quality. Problem statement. Burnout is characterized by emotional exhaustion, depersonalization, and reduced professional accomplishment. Bay 2024 found that staffing shortages, mandatory overtime, and excessive workload significantly contribute to burnout among healthcare professionals. Dow Aura 2022 reported that inadequate staffing affects both employee well-being and patient outcomes. These challenges increase turnover and tensions, reduce job satisfaction, and negatively affect healthcare quality. The purpose of the project. The purpose of the project is to reduce healthcare worker burnout through a comprehensive organizational intervention. Lead 2024 found that reducing burnout improves patient safety and quality of care. Zhang 2024 reported that lower burnout levels are associated with reduced turnover and tensions. This project aims to improve employee well-being, workforce retention, organizational performance, and patient outcomes. The proposed solution. The proposed intervention combines leadership development with organizational redesign. Jillian 2023 demonstrated that leadership-focused interventions can improve employee well-being and reduce burnout. Stillman 2024 reported that employees who feel valued by leadership experience lower levels of burnout. The intervention include leadership training, staffing improvements, workload redistribution, and regular assessments to monitor progress. Theoretical framework, social ecological model. This project is guided by the social ecological model. The model recognizes that burnout develops through interactions among individual, interpersonal, and organizational factors. Cohen 2023 found that successful burnout interventions address multiple levels simultaneously. Germani and Ciconia 2024 supported organizational approaches that improve workplace conditions. Meaningful burnout reduction requires changes across the entire healthcare system. Organizational resources. Successful implementation requires leadership support, financial resources, staffing support, technology systems, and quality improvement oversight. Bay 2024 emphasized that staffing investments reduce workplace staff and burnout. Sinsky 2022 found that burnout-related turnover creates substantial costs of healthcare organizations. Investing in these resources improves workforce stability, employee well-being, and overall organizational effectiveness. Stakeholder engagement. Stakeholder engagement is essential for successful implementation and sustainability. Alice 2023 found that communication and collaboration improve organizational readiness for change. Zhang 2024 emphasized the importance of employee involvement in workplace improvement efforts. Executive leaders, managers, frontline staff, human resources personnel, and quality improvement teams each provide valuable perspectives that contribute to project success. The implementation plan. Implementation begins by obtaining leadership approval and collecting baseline burnout data. Leadership training will then be provided to managers and supervisors. Ellis 2023 found that effective communication improves readiness for organizational change. Jankovia 2021 reported that effective leadership communication improves employee engagement. Progress will be monitored through regular assessments and performance evaluations. The timeline. The implementation timeline spans 8 weeks and follows a structured approach. During week 1 and 2, organizational approved, stakeholders engagement, and resource assessment activities will be completed. Leadership training and communication planning will occur during weeks 3 and 4. Staffing improvements and workload adjustments will be implemented during weeks 5 and 6. Project evaluation will occur in week 7, followed by sustainability planning during week 8 to support long-term success and workforce well-being. Evaluation plan. The evaluation activities will focus on measuring burnout levels, turnover intentions, job satisfaction, retention rates, and overtime utilization. Stensky 2022 emphasized the importance of monitoring workforce outcomes associated with burnout. Data will be collected through employee surveys, staffing records, and feedback mechanisms. Ongoing evaluation will support evidence-based decisions making and continuous organizational improvement throughout implementation. Dissemination plan. Project findings will be shared internally throughout leadership meetings, reports, staff updates, and organizational dashboards. Results will also be presented eternally through conferences and professional publications. Disseminating outcomes promotes transparency, supports stakeholder engagement, encourages adoption of effective burnout reduction strategies. Sharing findings contributes to evidence-based practice improvement across healthcare organizations and professional communities. The professional venue. The American Organization for Nursing Leadership, or the AONL annual conference, was selected as the primary dissemination venue. Gillian 2023 found that leadership interventions positively affect employee well-being and burnout reduction. Presenting findings to healthcare leaders is valuable because they influence staffing decisions, workplace culture, employee support programs, and organizational strategies that directly affect burnout outcomes. Expected outcomes. Several positive outcomes are expected from this intervention. Bay 2024 found that reducing excessive workloads improves burnout indicators and employee well-being. Lee 2024 reported that lower burnout levels improve patient safety and care quality. Anticipated outcomes included reduced burnout, improved morale, higher retention rates, stronger teamwork, and enhanced patient care across the organization. For the conclusion, healthcare worker burnout continues to affect employee well-being, workforce retention, patient outcomes, and organizational performance. Stensky 2024 found that burnout-related turnover creates significant financial burdens. Zhang 2024 reported a strong relationship between burnout and turnover intentions. Through leadership development, staffing improvements, employee support, and ongoing evaluation, healthcare organizations can create healthier workplaces and achieve sustainable improvements. Thank you.